Good afternoon, and thank you for joining us for the August 4th COVID-19 Virtual News Conference. My name is Mariah Miracle. I'm a Public Information Officer working in the COVID-19 Joint Information Center. Today's panelists include County Health Officer, Dr. Hoffman, Chief Executive for St. Joseph Health in Humboldt County, Dr. Roberta Luskin-Hawk, and Humboldt County Public Health Director, Sofia Pereira. I'll start with a brief update from the Joint Information Center before we hear from our panelists. A total of 5,269 Humboldt County residents have tested positive for COVID-19 as of yesterday. And later today, the JIC will report 82 new positive cases, breaking the single-day record that was just set last Friday, July 30th. More than 630 new positives were recorded in July. That's the third highest number of cases recorded in a single month, topped only by the winter surge in December and January. Since the most recent news conference on July 21st, the county has reported 18 additional COVID-related hospitalizations. And in that time, the county has recorded one death of a local person in their 30s. Health officials continue to urge all eligible residents to get vaccinated against COVID-19. Anyone with questions about vaccination, testing, or safety measures can reach out to the community information line at 707-441-5000. We answer questions in English and Spanish Monday through Friday from 8 a.m. to 5 p.m. Now we'll hear from our panelists, and let's start with Humboldt County Health Officer, Dr. Hoffman.
Thank you, Mariah, and a big thanks to Dr. Luskin-Hawk for being here today. Really happy to have her perspective in this next phase of what's going on in Humboldt County. So I want to just start off today by saying that the Delta variant of the coronavirus is here in Humboldt County, and it's widely circulating, and it's very different. It is not the same as the previous versions of the coronavirus that we've seen throughout the course of the pandemic. And I think, you can really see that now in our case numbers as they're growing rapidly. A few weeks ago, our case count was well under 10 per 100,000, now pushing up into the high teens per 100,000. We've seen a dramatic increase in hospitalizations over the course of the last week, as Mariah mentioned, and Dr. Luskin-Hawk will get into the details, but we are now at the highest level of hospitalizations we've seen yet in throughout the entire pandemic. So it is with all of that in mind, the rapid changes in this pandemic that we've seen, the swings that we do not take lightly, measures that are stronger, but they are necessary going forward. And so with that in mind, we are announcing today a return to universal masking for Humboldt County. I will be putting in a health order in the coming days that will go into effect at 12:01 a.m. on Saturday, August 7th. So this will be in effect for all people, vaccinated and unvaccinated, in all public settings, indoor and including outdoor crowded public settings and public events. We strongly encourage people to mask around others who are not in your household because this is spreading so quickly. And it's unfortunate to be at this point where we have to go backwards in these recommendations, but we really want to do this because we have to protect the critical infrastructure of our fragile hospital system in Humboldt County. And we want to continue to see businesses remain open. We certainly don't want to return to any lockdown situations. And we have to have kids in school this fall. It is an absolute priority for the health and safety of our community to have kids in school. So it's with all of that in mind that we're doing this. It is something that we will continue to monitor in the coming weeks and months as we hopefully see case counts come down and hospitalizations coming down, as well as vaccination rates going up. And I'm going to leave on that note with vaccination is the key to ending this pandemic. We need to get our vaccination rates up in order to get out of this. So we're going to continue to offer vaccinations through Humboldt County Public Health. continue to expand opportunities for people to get vaccinations and continue to answer questions as they come up about the vaccines that are safe, they're effective, and they're highly effective against the Delta variant and keeping you out of the hospital and keeping you from getting seriously ill and keeping you from dying from this very serious new threat to our community with the Delta variant. So thank you very much.
Thank you, Dr. Hoffman. Dr. Luskin-Hawk. Doctor, I believe you're still muted.
So it's amazing that I don't automatically do that by now. But anyway, thank you. Thanks for having me here today. I think most of you know that Providence in Humboldt includes St. Joseph Hospital in Eureka and Redwood Memorial in Fortuna. And while Redwood sees a few patients, really the bulk of our work around COVID treatment has been at St. Joseph because of our intensive care unit capacity, intensivists, infectious disease doc, and some other things that we have available. We also obviously have Mad River in our community to take care of some of our patients. But as we look at the impact of this pandemic right now, we've seen a rapid increase in the number of inpatients. When we looked at January of 2021, which was one of our highest periods, we had 16 people in the hospital. In the last couple of days, we peaked at 23. We're at about 19 today. A number of our ICU beds have patients with COVID who are seriously ill. And obviously anyone who's in the hospital is ill. In addition, the medical group and other primary care providers in our community are taking care of patients who are having some milder disease. I think I am fully supportive of this new mask mandate, because as I look at all the signs, the case rates, what we know about the Delta virus, the Delta variant virus, that it spread so much more effectively than the original virus. We know that this is taking off at a very rapid rate. Some of it is already, there's a lot that's already out there, and that our job now is to take care of the people who are impacted by it. But I think it's incumbent upon every member of the community and hospitals and public health to intervene in any way we can. The mask mandate is an important tool. We know that over the winter months, Humboldt County used masks effectively to have an impact on this virus. And so I applaud this order and fully support it. In addition, I can't underscore enough the importance of people who are not yet vaccinated getting vaccinated. We know without a doubt that over 99% of people dying of COVID are unvaccinated. That is a consistent finding. And so as my nurses in my ICU who are exhausted and, they so sad to see people who they're caring for, as you heard, one as young as in their 30s, dying of this infection, who are unvaccinated, and where they know that this could have been prevented. It's just having an emotional toll as well as the physical toll of a lot of people to care for. I think we just all have to be sensitive to the fact that unless we pull together and get vaccinated and take extra precautions, that when our hospitals get impacted, it not only impacts our caregivers who want to stay and care for us in Humboldt, but it also impacts just the ability for us to more easily care for someone who has other illnesses like a heart attack or something else. The reason we want vaccinated people to wear masks too is that if you can get a secondary infection, you can spread it to someone. And so we are asking just everyone to not assume that there's anything that's special about them, but to wear masks, to distance appropriately, to use the precautions that were outlined. Our healthcare infrastructure, everyone is ready to do whatever it takes, but it is not possible to do it without partnership of our community.
Thank you, Doctor. Director Pereira.
Yes, good afternoon, everyone. I just wanted to give a brief update on our vaccination effort. I think those of you that have been following it have known that we have been going to all parts of the county to make sure that we are reducing barriers, making it as accessible as possible to get vaccinated. And we have been seeing success with that. We are seeing people show up to these clinics. Like we've talked about before, gone are the days where you have 1,000 people getting vaccinated in a single day. But with this effort, we are seeing with every location that we are going to, people are showing up, whether it's 5 people, 7 people, or 40 people at a Crabs game. We had 35 people, vaccinated yesterday in King Salmon Fields Landing area yesterday, which we were very pleased to see. So those are the types of numbers we're seeing, and we're really pleased to see that. People are still showing up to get their first dose, to get vaccinated. And so we're going to continue on with this effort and continue to provide these opportunities. Really grateful for partners in the community that are, really encouraging vaccination and providing incentives. This Friday, we're going to be at Six Rivers Brewery during the lunch hour. And then going to Ace Hardware also in McKinleyville. They're providing gift cards as well. I just really appreciate these types of partnerships. To Dr. Luskin-Hawk's point, right? This is really a community effort. So seeing community organizations, our local business community really rising up and supporting this effort to get vaccinated, to keep our community safe is just so appreciated. And then also just want to note, for our veterans in our community, our vaccination team will be at the North Coast Stand Down this weekend. So just really want to encourage our folks that are veterans that want to get access to a variety of services and also get a vaccine. Our mobile team will be out there as well. We are going to be at a lot of different places the month of August. And so please go to My Turn. That is a great way to see all the different clinics that we are going to be at. I think folks, can see the urgency of the need to get vaccinated if you haven't done so already. And we are doing everything we can to provide as many opportunities, make it as convenient as possible for you to get your vaccine. Thank you.
Thank you all. Now we'll take questions from reporters, and we'll start with Thaddeus Greenson from the North Coast Journal.
Thanks very much, Mariah. So Dr. Hoffman, I'm curious what modeling, local modeling indicates the effect of the mask mandate might be on disease transmission and case counts locally.
Thanks, Thaddeus. Really great question. Modeling is such an important part of what we do, and it also is, rarely proves to turn out exactly the way we expected it to. So, I think there's a lot of different things you have to put into a model. And one of them is, how much is the community going to participate in an intervention? And so we've put a lot into this. I'll tell you that the leadership of Humboldt County has broad support for this new mask mandate. And I think you're going to see that coming out in the coming days, and that hopefully we'll get the message out that that we, this is serious. This is real. So, so if adopted well, I think that this could be very beneficial and could reduce case rates. I think if people followed it to the T, it could reduce it by more than 50%. I mean, if you look at what we saw over the winter months, we know that these the mask is an effective tool, and it was one that was being used widely then. I think if we look at realistic modeling, it could potentially decrease it by more like 25% or 15%, somewhere in there. But every little bit counts at this point, honestly. We're talking about hospital capacity here. So by reducing, 20 or 15%, we're talking about several extra beds in the hospital, which is going to alleviate the strain as we potentially haven't even seen the peak yet of this surge of cases in terms of hospitalization. So it's really up to the community on how effective this tool is. But we hope everyone follows it, and that will, determine how effective it is as a tool.
Excellent, thank you. And then just a quick follow-up, which you already touched on a little bit, but as you've said repeatedly, people are tired. This is, everybody's tired of COVID, and this has been a long slog. So what is the kind of messaging strategy on part of public health and the JIC and the county to just kind of convey the importance of this mask mandate at this moment in time?
Yeah, this is not something that any of us are taking lightly. We're doing this to protect our community. We're doing it to keep everything open, keep businesses open, keep the schools open, and we're doing it to protect the healthcare facilities in our community that are fragile, that could easily be overwhelmed with COVID cases and not be able to take care of all the other things like Dr. Luskin-Hawk mentioned. So I think all of that is the message that we're putting out there with this order.
Okay, thank you.
Thank you, Thad. Isabella Vanderheiden from the Times Standard.
Hi, thank you. Although case counts are climbing at an alarming rate, both locally and across the country, there are reports that vaccination rates are also going up across the country. And what would this panel attribute that shift to? And are we seeing a similar trend locally?
That's a great question. We're definitely tracking the numbers closely to see if there's a trend over time with an increase. Definitely in the past couple of weeks, anecdotally, we have been seeing an increased interest in getting vaccinated. And I think understandably, the Delta variant really has been a game changer for our community. I mean, the impact that it has had so rapidly, I think has been a call to action for many folks.
Yeah, and I'll add, we were actually asked by the state recently because we had one of the best increases in the state over the last couple of weeks for first doses. What were you doing? And we said we're doing the same thing we've been doing. We're going out to places that we think a lot of people will be available and would want to get a shot. We're partnering with community partners, businesses, community organizations, healthcare organizations, and we think that's now paying off, and that we had that infrastructure in place, and there is definitely more worry among the community with Delta here.
Thank you.
Thanks, Isabella. Hank Sims from the Los Coast Outpost.
Hi. Well, we've been told about sort of lots of delays and wait at the new testing site, at the new OptumServe testing site at the Wharfinger building. And given that the surge is hitting us again, is it possible to ramp up testing again? Is it and is that something that you're looking at doing, and how?
Yeah, well, we are. I'd say in the last 7 to 10 days, we've seen historic levels of testing after seeing about 6 to 8 weeks of historic lows of testing. So we're trying our fastest and best to make testing available. Our local lab here has hit new highs several times in the last few days, in the last week. We have a mobile testing team that has again been slightly dormant, and they're starting to ramp up and do a lot more testing around the county in the next couple of days, given response testing. We're working with a lot of employers to try to roll out the state program, which allows any organization, business, church, anyone really to enroll in the state program to get rapid tests or send PCR tests to the state, self-collected. Doesn't have to be through a healthcare provider. So these are all ways that testing can become more available in the community, and we get reports on the Optum usage weekly. So I haven't seen that this week's usage. So I'll be curious to see if there's that much of an increase. It was down to around 10% of capacity being used across the county for Optum. So that means 90% of the appointments throughout the month of July had not been used for Optum Serve. So we if we need to, we will ramp up more though in response to this current surge.
And one thing I just want to add as well is that, we're working with Optum Serve, we have public health doing testing, but just also want to remind folks that we have pharmacies here locally where you can get tested. There are a variety of places to get tested. And one thing I also just want to note, I don't know if Dr. Luskin-Hawk wants to speak to this, but if folks are interested in getting tested, just to reduce the strain on our healthcare system and our hospitals, please use these other resources like Optum Serve or a local pharmacy to get your testing, especially if you're asymptomatic and you're not showing, illness, severe illness of some kind.
Yeah, just to follow up on Sofia's comment, it is very helpful to the hospital when people who really just want to test and don't feel well, but don't need an emergency department visit or a hospital stay, use these other locations, leaving our capacity to address the needs most rapidly for the people who are sickest with this virus and other things. So yeah, thanks, Sofia.
Any follow-ups, Hank?
No, I'm good. Thank you, Moran.
Great, thank you very much.
What?
Michael Patterson from North Coast News.
Yes, thank you. So the question for Dr. Hoffman. So last month, Governor Newsom implemented a new restriction requiring, state employees and healthcare workers to be vaccinated to continue working. I just wanted to kind of see, what your stance is on those kinds of requirements, and if public health is perhaps drafting, plans to ask county and local governments to implement similar kinds of restrictions.
Yeah, great question. So the state health officer order that came out a couple of weeks ago addresses healthcare entities and some congregate living facilities like jails and homeless shelters, and requires in those places of operation that for the employer to determine which staff are vaccinated or unvaccinated, and in the unvaccinated implement testing programs and then superior masking levels for those who are unvaccinated, surgical type of masks like we're wearing today. And Dr. Luskin-Hawk might want to talk a little bit more about this because it does impact her facility as well. So as far as county government goes, public health falls into this as well, because we have a clinic. We're working with the county to implement this in multiple divisions within the county that fall under that. What Governor Newsom did was take that state order and applied it to other things that the state order didn't apply to. So all offices of state government. So it's not requiring vaccination. It's putting those higher levels of protection on for the unvaccinated. So currently we are in the process of implementing that in county government where it is required. There are a lot of conversations going on across the state, and there are places that are considering those sorts of things. I know healthcare entities who are considering mandates for vaccination, and we know that will increase the vaccination rate dramatically. Point to several entities across the country that have implemented vaccine mandates and got their vaccination rates well above 90%. And locally, we have very dramatically different vaccination rates among certain healthcare entities, some as high as the high 80s and pushing 90%, and some much lower, closer to like 50%, more like the rates in the county. So I think all these tools are necessary. Yes, they're necessary to both encourage vaccination and get us to a place of higher vaccination rates, and also for those who aren't vaccinated to be able to monitor them and make sure that they're not spreading COVID in the workplace.
And kind of one quick follow-up related to kind of restrictions. Back in June, we were talking about loosening these restrictions as kind of being this turn in the pandemic and kind of a good idea that we can handle it. I mean, looking back on this now, I mean, obviously hindsight's 2020, but I mean, does this loosening of restrictions kind of seem like a mistake in hindsight?
I'll go back to what I said in the beginning, which is Delta is very different. This is not the same virus. It's almost like we're dealing with a whole new pandemic here. You're talking about contagiousness as high as double what it was previously, approaching chickenpox level, but much more lethal. And there's only a few other things, that are much more contagious in this, including measles. So it's really been a game changer. Should we look back and say we shouldn't have done it? Yeah, like you said, hindsight's 2020. I think those of us who really got to see family and friends and enjoy life for a little bit, I think it was important, and I think we might see more of this going forward. We might have this ebb and flow go on for a while. We just don't know what's coming next with this virus, and so I think we have to be prepared to respond to it. But we have the tools now, and we've been through it, so hopefully it'll be easier each time.
I think it's worth, in a follow-up to Ian's comments, it's worth noting that the longer a large group of people is unvaccinated, this virus will continue to mutate. And we know that Delta can cause a lot of havoc, but we also are at risk that with a large segment of a population unvaccinated, that the mutations will continue. That's just the nature of viral infections. And so again, just another really important reason to have that broad immunity in our community. It makes a substantial difference.
Great, thank you very much.
Thanks, Michael. Shanila Kabir from Redwood News, pardon me.
Hello, so I talked to Julie Benbow last week from the Humboldt County Convention and Visitors Bureau, and she told me tourism is doing really great right now in Humboldt County, and she's really concerned. So I really just wanted to talk to you about that, and how are you monitoring that? Did you hear me?
Yeah, I think that we're at a difficult spot. We want to continue to encourage businesses to stay open. We don't want to return to anything like we had before, and I don't think it looks necessary right now. So we're taking one step, which is a mask mandate, to try to get a control of this. As far as I know, every county in the state is open for business, and tourism is going on in all of those places. So we're just taking the steps again to protect our county, like many other counties have over 20 now with this mask mandate, and hope that we don't have to go backwards any more than that.
Thank you. That's really it. Thank you.
Thank you, Shanila. Lauren Schmidt from KMUD News.
Thank you so much. Dr. Hoffman, do you know how many of the recent positives have been breakthrough cases? And do you happen to know the efficacy rate of the vaccines against the highly contagious Delta variant?
Yeah, so we've been trying to get a handle on some of this data. We've got a lot of data coming at us rapidly. Obviously, with this large increase in cases, we're doing our best to keep up with those numbers. Here's what I can tell you, what I know for sure right now. Since the beginning of the pandemic, about 5% of our total cases in Humboldt County have been breakthrough cases. So it is still a very small number overall. As we get more and more vaccination, we expect that number to go up. I mean, you look at a place like Marin County that has upwards of 80% vaccination rate, and they have a high percentage of their cases are breakthrough cases because those are the people who are in the community. So, you know, if there's very few unvaccinated people there, there's just not going to be as many, percentage-wise, aren't going to be as many of the total cases. So we know breakthrough cases are going to happen. They've been expected. And we know that in July, about a quarter of our cases locally were breakthrough cases. Now, the vast majority of those, overwhelmingly, were mild to asymptomatic, and a very small handful of hospitalizations. You know, again, we're trying to get all the data together so we can present it, but it's a very small number. You know, very similar to the nationwide data. You know, probably on the order of 95% or more of the hospitalizations that are happening across the country are in the unvaccinated. So, and no deaths whatsoever in the fully vaccinated group in Humboldt County, and very, very few nationally. So when we talk about the vaccination, the vaccine, or all three are very effective. I think what we have, they're very effective against severe disease, hospitalization, and death. They had been very effective against even mild disease against the previous versions, and I think that's where we've seen some slight decrease in effectiveness. And now this, you know, what we can verify is that it can spread among the fully vaccinated. But that doesn't mean that the vaccines aren't working. It just means that the virus is working harder, and that means we have to work harder too. Dr. Luskin-Hawk, I don't know if you want to add anything to that. She's a highly trained infectious disease doctor who has a lot more experience than me.
Yeah, I think you did a really excellent job at explaining it. It's you know, we're going to see some breakthrough cases, and I think that the responsibility for people who are vaccinated is to try to avoid getting a mild case or even an asymptomatic case and spreading it to someone. Some patients have had flu-like symptoms, but as Ian said, hospitalization is quite rare, and we are not seeing deaths. But they all work for the important thing, which is they keep you alive.
Thank you both very much.
Thanks, Lauren. Ryan Hudson from the Red-Headed Black Belt.
Hello. Yes, I have a few questions. I want to start by asking Roberta, if you can tell us both within and apart from the ICU of those cases, how many of them are among vaccinated individuals?
It's a good question. We don't track it that way on a daily basis. So there's some deeper information that then gets shared with public health. And the denominator is, the numbers are so small that any percentages probably wouldn't be helpful, which is part of why I don't know on a daily basis. I'm sorry, I can't help you there. But I have no reason to think that our trends would be different. In fact, because we see the bulk of the hospitalizations in county, what Dr. Hoffman is referencing probably is mostly our data with a little bit of data from Mad River and from Redwood.
Okay, thank you for that. And regarding hospital staff, I am curious if you can give us an idea of, you know, percentage-wise, how many staff within the local system here are unvaccinated?
Yeah, it's interesting. You know, vaccination rates in general, even in the country, are very high among physicians. They are much more reflective of community preferences among even nurses and other healthcare workers. So currently, I think we're seeing a rate it's not what I'd like it to be yet. It's you know, somewhere above 50% of at least one shot and above 75%. I'm sorry, above 50% for two shots and above 75% for at least that first shot. And we are, but we're putting more in place to make sure we're now getting reporting of when they've had it in the community, because we didn't have access for that. And the state's put in some clarity. It's been helpful for us to work with our caregivers to make sure they fully understand what's available, that we understand if they're declining, why they're declining, and then setting up ongoing testing for people who choose to remain unvaccinated. That being said, that when they're working in the hospital setting, we mandate universal masking always. And so what we are not seeing is our caregivers, if they get exposed to the community because they're community members, we're not seeing them bringing in and giving it to patients. That's not something that we're seeing, but we believe for their own health and to set good examples, they absolutely should be vaccinated. We just recognize that right now they still have a personal choice.
Okay, thank you. And if I could sneak in a follow-up on that as well, do you anticipate sort of following suit with Governor Newsom's plan to require vaccination at any point for hospital care workers?
Yeah, I think over the next week, you'll see more definition around our policy to make sure that we're aligned with any state mandates and the best kind of public health recommendations. So you will definitely see that. So among our caregivers. The other thing I didn't mention, which is related but unrelated, is that for anyone who's hospitalized for another reason or comes to our ER for another reason, we're also offering vaccines in that setting. So trying to reach out more broadly.
Great, thank you.
Thank you, Ryan. All right, we'll start back with the North Coast Journal. Any additional questions, Thad?
Yeah, thank you. I think this would be for Dr. Luskin-Hawk. I'm curious, back kind of when we were in initial surge planning, there was a lot of talk about workforce readiness and making sure, that there weren't just enough beds, but enough trained professionals to care for Humboldt County if there were a true surge in illness. I'm curious, Dr. Luskin-Hawk, if you can give an update on the current staffing levels, and then also what's being done to bring more staff in line should they be needed.
Yeah, that's a good question, Thaddeus. What's interesting, what we're facing in Humboldt County, across the state and across the nation, is an extraordinary workforce shortage right now. So that back in January, there were traveler nurses available and people from agencies and local nurses, and we were ensuring that we had people. What's happened as we kind of turned that corner of about 18 months into the pandemic is that we look back and about 100,000 nurses had retired from nursing across the country. That when we talked to the staffing agency we used to pull in temporary nurses from other areas of the country, they don't have the number of nurses that they have requests for. So we now are working with multiple agencies. So we have had a very high number of positions posted for regular hire. In addition to that, we've reached out really over the last several months, not only just recently, for traveler positions. We filled some gaps with those. When we've looked to see, we still need more, and we've reached out to additional agencies. More recently, we also always hire graduate nurses, often from College of the Redwoods. We just, when we hire them, they need a minimum of 3 months of training. So we hired, we just recently had 28 new nurses that we hired who were trained and now are off their training period. And we are in the midst of hiring about another 35 to 40 nurses, again, to be trained for positions. So it's kind of there's a multi-pronged approach. We're being aggressive about making attractive offers to people. I will say that one of the challenges for our traveler nurses has been housing in Humboldt. We've had some people who have agreed to come and then found getting housing so challenging that they've backed out of contracts. So now we've partnered with some realtors and others to try to help them get housing because they're finding it hard on their own. So it's a long way of saying that we want more staff than we have, but we're working with the staff that we have to take care of patients. So recently, this week, we've started canceling some elective surgeries in order to preserve staff beds for patients with COVID. That's not ideal for the patient who has been waiting for a surgery. I understand that. But it's for the safety of the community doing this surge. But that speaks to what Dr. Hoffman was saying, is that, we can all have a more robust health system if we tamp this down and allow our caregivers to do the full spectrum of care.
Excellent. Thank you.
Thank you, Thad. Isabella, any additional questions?
Yes. Sorry, I have to go back to my question here. Today, Dr. Anthony Fauci noted the possibility of yet another variant emerging as case counts skyrocket and the possibility that such a variant could challenge the efficacy of our vaccine. I realize this is somewhat speculative, but can Dr. Hoffman speak to this point?
Well, I think if you look at the Delta variant and how it took this sort of giant leap, even from the Alpha variant, which we saw the effect of in our community, the last surge. Yeah, we're worried. We're worried that this could turn into something even stronger and bigger, and certainly something that could get around the vaccine efficiency would be could potentially be much more devastating even than the Delta variant. So the faster we all get vaccinated, the less likely that is to happen. To Dr. Luskin-Hawk's point, every chance that the virus gets to mutate by infecting another person, it will potentially mutate. So time is of the essence, and we want to encourage everyone to get vaccinated and we're trying to make it as easy as possible.
Thank you.
Thank you. Hank, any additional questions?
Yeah, real quick, and perhaps this is most for Dr. Luskin-Hawk, but I just want to say that it seems like the way that to fight misinformation or vaccine hesitancy or vaccine skepticism, like a really powerful way is to share concrete stories. And I wonder, I know that you're limited in what you could say, but I think it would be really helpful if you could share what more you can about the case of the person in their 30s who passed this week. The course of that person's illness, whether they presented with comorbidities, just as much like detail as is possible for you to share about the course of that person's illness would be helpful. So perhaps, I don't know if you can do that.
Yeah, thanks, Hank. I mean, I think, as you know, highly restricted due to things like HIPAA, but by the same token, I think that what people do need to understand is that a patient in their 30s who sought medical care got high quality intensive care unit care in a unit with critical care nurses and board certified intensivists, a whole team of people working together with experience in dealing with this virus after a prolonged hospitalization, which means that it wasn't that he waited too long. He came in to seek care, who had, according to what I'm told, and I've never seen this man's medical record, but according to the ICU nurses, who were quite distraught, had no unusual underlying diseases, no immunodeficiency, nothing else, and despite their best efforts, died. And I think that story, while no further details would be available, is really compelling. That the sense that people have gotten that if I'm young enough, if I'm healthy enough, this virus is not going to touch me, is really important. And I think in addition to that, if you look at the weekly data on the Humboldt Health Alert, there were also about 4 deaths in people in their 50s, and so I know people who didn't want to take a vaccine but left children behind, and who passed away, and they were parents, and so the toll of this is real, and I do think we have to connect to the community and the readers. It's almost people have gotten numb with the numbers, and they feel like this refers to some other, and it's not. It's real people. It could be your neighbor, and I think if you're a parent, or you know, and you care about your health in any way, that that a death from in someone who is unvaccinated, in my mind, is needless, and it also, it's a tragedy for that person. It's a tragedy for the people who love them, but also as I try to support my caregivers and healthcare team, it has a devastating effect because it's emotionally draining, and they feel like it didn't have to happen. And so we need to care for them so that they can take care of all of you and stay in healthcare. You know, people retire when it gets just too overwhelming. So that's my long story. That's about as much as I can tell you, but I hope it's enough for you to connect to the fact that this is hitting people who don't have anything special wrong with them, and it's hurting them, and it's killing some of them.
And if I can add to that, you know, exactly what Dr. Luskin-Hawk is saying, we are seeing this happening in younger and younger folks. The deaths in the 50-year-olds, the multiple hospitalizations in 40-year-olds. And we review all of these cases at Public Health as well. And I tell you that exactly what we're seeing in Humboldt County is exactly what we've seen across the country, which is that, yes, some of these people have pre-existing conditions, but not all of them, and many of them do not. They are people just like yourself, just like your neighbors, who are considered to be in good health. This virus can take anyone, and being vaccinated is your absolute best chance. The death of the young gentleman this past week has also taken a very hard toll on our public health staff here, who worked very hard to try to protect everyone. This is a really tough time for all of us in healthcare. We feel really for the staff in the hospital and our staff here who are working so hard to try to stop the spread of this disease.
Yeah, there's some data that suggests the Delta variant is 2.5 more times likely to cause hospitalization than some of the original strains, right? So it's not only more contagious, it's more aggressive. And so seeing, you know, deaths in young people is part of the constellation that we're seeing.
Thank you. Michael from North Coast News, any additional questions?
Yes, one quick question that I think would be best for Sofia Pereira. I know the case investigations, the way Humboldt is doing case investigations now is changing because of this reduction in state staff. So I was just kind of curious of how many people are currently working on case investigations, and you know, what now is considered a vulnerable population, you know, with the Delta variant being so transmissible and dangerous.
Thank you. Actually, if it's all right, Dr. Hoffman, just given the recent changes with the prioritization of our case investigations, I'd like to turn it over to you.
Sure. Yeah. Thanks, Sophia. Geez, you know, exact numbers on the staff, I can't give you, but it's been dramatic reductions. I'd say, you know, at least 30 to 40% reduction in the staff in the investigations. We had a tremendous number of staff from the state throughout the winter surge months, and even up until as late as June, they started reducing them, and then just slowly have been reducing them more throughout the last 6 weeks. So we're doing everything we can to build internal capacity to continue as much investigation as we can with as small of a group of people as we can. So part of that is yes, you know, I think the public's really aware of what it means now to get a diagnosis, to be on isolation for 10 days if you're positive, to quarantine if you are exposed to that person who's positive for at least 10 days, and to notify your contacts. I think, you know, that's really what our investigations team does 90% of the time for these low risk folks who are either asymptomatic or mild symptoms, many of them being followed by their doctors. Doctors might be giving them these quarantine and isolation orders as well. So it's a community-wide effort. So what we're focusing on as public health are the areas where there is the absolute highest risk for spread, for widespread. So places where it could rapidly spread to, dozens or even, 20, 30, 50 people at a time. So those are settings like the skilled nursing facilities, long-term care facilities that we have that house a lot of vulnerable older patients. But it also extends to things like the schools where there's a lot of unvaccinated children, things like summer camps and daycares, and as well as larger businesses that they have a lot of people working close together, where people can't always take the distancing measures that might, somewhere in an office setting can. So those are some of the ways that we're prioritizing this going forward. And we've been doing that the whole time. It's just that each time we have to, cut back on staff, we have to narrow our focus a little bit more and ask more of the public for their own follow-up from when they get the diagnosis or get a positive test. We do still attempt to contact every single positive person at least 3 times. And, but we're finding more and more is that people just aren't answering the phone calls or they hang up on us. And so our staff can keep reaching out over the course of 10 days to all of those people. So we make those 3 attempts. And then if there's not a callback, if there's not, an answer, then we have to move on.
Great, thank you.
We have just a few more minutes here. Shanila, do you have an additional question?
No, I'm fine. Thank you.
Thank you. Lauren from KMUD, do you have an additional question?
Yeah, really quickly, Dr. Hoffman, if this surge continues to worsen, is there a potential for another shelter-in-place order?
I'll be honest, I don't think anyone's talking about that right now. So we just hope everyone wears their masks, get vaccinated, go get tested. If you don't feel well, stay home. If you know that you're exposed to someone, if we all follow those guidelines, we will not see that kind of surge. So, I'll just say that I think even with Delta being so transmissible, we still have fairly high vaccination rates. We have just a little bit under the mean in California, which is a little bit over the mean for the US. So we do have that layer of protection that hopefully we would never have to go back that way. But none of us wanted to be here with masking either. And here we are now with nearly half the state under a masking order again.
Thank you very much.
Thank you, Lauren. Ryan, do you have a quick question to ask?
Yes, real quickly, I was just hoping that Roberta could clarify. She said earlier that 19 people are currently hospitalized in Humboldt with the COVID. I'm wondering, of those 19, if that's current, how many of those are in the ICU?
Sure, fair question. 4 of them are in the ICU as of this morning.
Okay, thank you for that. And then a quick one. Can you talk to us about the difference in the symptoms of the Delta variant as opposed to the original strain, and is that being seen in children?
Yeah, I'd let maybe Dr. Hoffman can speak to that.
Thank you.
Sure.
Sure. Yeah. I think anecdotally, there's been some discussion about potentially different symptoms in kids, more GI symptoms, more headaches. I don't think we have enough data right now locally to say anything, but I think we know that this virus can cause a lot of different symptoms. So traditionally, cold symptoms, runny nose, coughs, sinus type things, aches, fevers. But we do know it can cause diarrhea, vomiting, abdominal pain, headache. So really at this point, if you have any symptom, check in with your doctor, ask them if you should get a test, or if you don't have a doctor, feel definitely, call for advice or go get tested somewhere. I think that's really the key point. And if you know you are exposed, stay home, monitor for symptoms, and get a test after about 5 to 7 days after that exposure. So those are the things that are going to keep us safe and keep us out of trouble.
And
Thank you.
one more comment, you know, in Humboldt, we have such issues with access to primary care. So when we say see your doctor, sometimes that seems like a daunting thing, but certainly many organizations have virtual visits and some other options to get further information. I know if you go to the providence.org website, there's a chat box that can talk about symptoms. There's access to virtual visits. I think that, you know, Open Doors virtual visits, sometimes the Providence Medical Group does. So it kind of lets you know when you should get tested, or if you're test positive, but you're concerned you're still not feeling well. There are things you can do other than going to the emergency room. And I would encourage, again, that the emergency room be for the most sick patients, but those are some resources for patients who still have concerns, but aren't as sick. Like they can get a little pulse oximeter to monitor their oxygen and have check-ins with a healthcare professional and be cared for, you know, kind of recover safely at home if there's someone who has relatively mild disease.
Thank you.
Thank you, Dr. Hoffman. Thank you, Dr. Luskin-Hawk, and thank you, Director Pereira, for joining us today. Thanks to all of our media representatives as well. We'll get the recording out to media as soon as possible. Thank you all.